So this is tutorial number 4 on biochemistry. Tutorial number 4 on biochemistry. So we begin. So we have a 65-year-old suffering from gout. Gout. Again, if you were here yesterday, you will know what gout is. Gout is what? An increase in what? Uric acid in the blood. And these accumulate in the joints, start causing what? Pains. Start causing pains in the what? In the joint. Now we are saying that this man is suffering from what? From gout. And is complaining of pain in the kidneys region. Ultrasound revealed what? Renal calculi. As a result of what process were they formed? As a result of what process were they formed? Again, we made mention that gouts are coming from where? From purine what? Nucleotides. They are coming from purine nucleotides. I believe you guys can remember. Purine nucleotides. So here you are thinking of what? A decay of what? Purine nucleotides. Purine. And we spoke about xanthine, hypoxanthine, xanthine oxidase. We said xanthine oxidase is the final what? Pathway for the conversion of xanthine or hypoxanthine to uric acid. This is just by the way. I just want to make sure that we can recollect what we did yesterday. Like I said, Krok keep repeating the questions, but in a different way. You where this question has come like 50th time. This is the 50th time it has come, if I'm correct. Okay, so please make sure you watch the videos. All right. Now we have a 5-year-old child who often feels ill with respiratory disease. So all the time, the same problem. And look at it. It has enzymatous appearances. When we say enzymatous appearances, I don't know if it's here, but I may mention that eczema has to do with what? Dermatitis. Or eczema has to do with a problem with what? Allergic reaction. So this patient is suffering from what? These kind of allergic reaction after consumption of what? Some food product. Now, tendency to prolong cause of inflammatory process. What kind of diathesis can be suspected in this case? Like I said, we are thinking of what? Of allergic sort of what? Reaction to the food this patient is taking in. But first of all, they are asking us what is diathesis or what type of diathesis is this an example of? So you must know what diathesis is. Now, diathesis is simply a hereditary or constitutional predisposition to a disease. Or let me just say, it is a risk factor to a disease. It is a risk factor or a predisposition to a disease of a particular medical condition. All right, and we can add, and the following types of diathesis can be found. So if I are you, I will write these things down. We can talk about tubercular diathesis. If it's the word tubercular, so tell you that it has to do with what? With tuberculosis. Right? Good. We have strumous diathesis. Strumous. Strumous diathesis. And this has to do with thyroid swelling. We have hemorrhagic diathesis. And the word hemorrhagic simply means what? Bleeding. So a bleeding disorder can be described as what? A diathesis of hemorrhagic origin. Then we have asthenic diathesis. Which is actually what? An excessive inflammation or reaction. The asthenic means what? Excessive inflammation or reaction. Example is an allergic reaction. All right. So that will be for what? For asthenic. Then we have what? Scrofulous diathesis. Scrofulous. Scrofulous diathesis. And this can be found in glandular swelling or glands that is swelling. Glandular swellings. So these are some of the diatheses that you can find. This is some of the diatheses that you can find. But look at it. We have what we call what? Now in this question, they're giving us what? Eczematous. Eczematous appearances after consumption of food product. So definitely you are thinking of what? Of atopic dermatitis. Atopic dermatitis. Atopic dermatitis. Atopic dermatitis. So although we could be thinking of this as asthenic, because for me, this is what? Asthenic diathesis. Asthenic diathesis. However, Krok says it is manifesting itself as exudative catarrh. Exudative catarrh. Exudative catarrh. Meaning, we can think of this as what? Exudative what? Catarrh. But if you're looking at the exact type of diathesis, this should have been what? Asthenic. Because I made mention that asthenic has to do with what? Has to do with allergic reaction. And this is a typical what? Allergic reaction. A typical allergic reaction. I'm taking my time to break this down so that you understand it. Now for Krok, please, exudative catarrh. Exudative catarrh. All right. Now we have what? The greater amount of nitrogen is excreted from the organism in the form of urea. In the form of urea. Now, inhibition of urea synthesis and accumulation of ammonia in the blood and tissues are induced by a decreased activity of which liver enzyme? Which liver enzyme? Now, yesterday we talked about ammonia being toxic to the brain, right? We talked about ammonia being toxic to the brain. And one of the ways of detoxifying ammonia is what? Is glutamate or glutamic acid is what detoxify what? Ammonia, making it less toxic to the brain, right? Now, another way of excreting ammonia from the body is through the urea cycle. It is through the urea cycle where the ammonia is converted to what? To urea, and urea can be excreted through the urine. Urea can be excreted through the urine. Now, another name for urea cycle is called the ornithine cycle. I'm saying this because you are likely to see it being repeated. Ornithine cycle. Ornithine cycle. Ornithine cycle. That is ORNITHINE. Ornithine cycle. That is same as what? The urea cycle. And it uses the enzyme carbonyl phosphate synthesis. Carbonyl phosphate synthesis. So that is what we will be what? Thinking about. So we are thinking about it as what? As B. Thinking of this as B. Again, this is what? Urea cycle. Urea cycle. All right. We are having a 35-year-old patient who often consumes alcohol. Look, consumes a lot of what? Alcohol, and was treated with diuretics. Yesterday, we established this thing, or even in our pharmacology lectures, we established that when you give people diuretics, example, loop diuretics, example, furosemide, what happens? You are excreting a lot of what? Of potassium. You are excreting a lot of what? Potassium. And as a result, there will be what? Hypokalemia. There will be hypokalemia. All right. Now, let's look at the question. The question said they appeared a serious muscle and heart weakness, vomiting, diarrhea, blood pressure is quite low, and depression. Now, this condition is caused by intensified excretion of what? Of course, potassium. Potassium. Again, if you have not watched our previous video, please do justice to that, because all of these things, we discuss them. After intake of rich food, again, when I say rich food, what do we mean? We mean by food that is rich with what? With fats. Food that is rich with fatty acid or with fats. Some books, they will say after intake of fried rice or rich food, they mean that there's a lot of what? Fat in this kind of what? Food, or a lot of what? Oil. Now, a patient feels nausea and sluggishness. With time, there appeared signs of steatorrhea. Again, what is the meaning of steatorrhea? It means what? Fatty stool, or stool that contains what? Fat. Now, blood cholesterol is 9.2. Now, the condition was caused by lack of, again, if you are taking a lot of fat, what do we say is used to digest fat or emulsify fat? We are thinking of what? Bile acid. You are thinking of bile acid. So if these bile acid are decreased, what it means is that the fat that you have taken in or the rich food that you have taken in will not be what? Emulsified. And if it is not emulsified, it cannot be what? Digested, and cannot be absorbed by the body. And hence, it will come down as what? Fatty stool. So here, you are thinking of a deficiency of what? Bile acids. Bile acids. So E. Good. Now, examination of a man who hadn't been consuming fat. That means the person has not been taking what? Fats, but had been getting enough carbohydrate and proteins for a long time. Revealed dermatitis. Guys, do you remember the vitamin responsible for dermatitis, or the deficiency of the vitamin that causes dermatitis? Of course, you are thinking of what? Pellagra. You are thinking of what? Pellagra. You are thinking of what? Pellagra. Now, there's what? Poor wound healing. Again, and there's vision impairment. So vision, you are thinking of what? Which vitamin? Of course, you are thinking of vitamin A as well. You are thinking of what? Vitamin A. So what is the probable cause of the metabolic disorder? What it means is that which kind of enzyme deficiency is causing all of these what? Symptoms that this patient is what? Having. Which of these is causing it? So first of all, we said lack of vitamin A will cause what? Vision what? Impairment and what? And poor wound healing. Now, vitamin PP or Pellagra, that one is responsible for what? For dermatitis. And Pellagra also means what? Vitamin B3, right? But they didn't bring any vitamin B3 in this question. However, apart from vitamin B3 that is responsible for dermatitis, you are also thinking of what? Linoleic acid. Linoleic acid. Linoleic acid. So, vitamin B3 or niacin is not the only vitamin deficiency that can cause what? It's not only substance that can cause deficiency of skin or that can cause dermatitis. Another one is what? It's linoleic acid. It's actually a fat, not a vitamin. It's a fat. It's a fat. It's a fat. So therefore, though they didn't give us much information, but we can think of this as what? As A as our likely what? Answer. As A as our likely answer. Our A as our likely what? Answer. Because you can find more over here than lack of PP. Of course, PP is the same as what? Niacin. PP is the same as what? Niacin. But over here, not only niacin we're looking for, we're also looking for what? Vision impairment and wound healing disorder. That's why here, a more appropriate one will be what? Will be A instead of what? C. So here your answer is A. Is A. All right. Now we have a 44-year-old woman complaining of common weakness, heart pain, considerable increase of body weight. Okay. There is moon-like face. Guys, when you see this kind of symptoms and look at it, there's hirsutism. That means what? Hair. hair all over. Okay, moon-like face, hirsutism, you are thinking of what? Increase in what? In cortisol level. You are thinking of increase in cortisol level, also known as Cushing syndrome. This is what? A Cushing syndrome. And hence, we have all these things. Look at it. Fat is mostly accumulated in the region of the neck, upper shoulder girdle, and in the stomach. What is the cause? So again, you are thinking of this as what? As Cushing syndrome. And in Cushing syndrome, there's a production of what? Cortisol. And cortisol also means what? Glucocorticoids. Glucocorticoids. So we are here, we are thinking of what? Increased production of glucocorticoids. Increased production of glucocorticoids. Why? Because this is what? Cushing disease. Cushing syndrome, sorry. All right. We have an experimental animal has been given excessive amount of carbon level glucose for a week. For a week. What compound can the level be found in? What compound can the level be found in? First of all, you need to know that excess of carbohydrate. Now, this person has been given what? Excess of carbohydrate, glucose, for a whole week. Now, excess carbohydrate in the body are normally converted to what? To palmitic acid. Yes, excess of carbohydrates are converted to what? To palmitic acid. Now, don't forget, we also said that glucose is also stored in the liver as what? As glycogen. But here, we're not referring to what? To the liver. No, but we are referring to what? The storage of what? These carbohydrates. And they are converted to what? To palmitic acid. They are converted to what? To palmitic acid. So somebody who has been given a whole lot of glucose, just know that this person is trying to what? Or eventually will accumulate a lot of what? Palmitic acid in the body. So here we are thinking of what? Palmitic acid. Palmitic acid. So here we are thinking of what? Of A. We are thinking of A as the answer. All right. We have, after a serious viral infection, a 3-year-old child has repeated vomiting, loss of consciousness, and convulsion. Now, examination revealed what? Hyperammonemia. That means there are a lot of what? Ammonia in the blood. A lot of what? Ammonia in the blood. And again, what do we talk about ammonia? We said ammonia is either detoxified by what? By glutamic acid, or what? Or they have been excreted through the what? The urea what? Cycle. They have been excreted through the urea what? Cycle. And I said another name for urea cycle is what? Is the ornithinic what? Cycle, or the ornithine cycle. The ornithine cycle. Am I right? So look at the option here. What are you thinking about? Definitely either there's a problem with what? With how do you call it? Either there's a problem with the glutamic acid, or there's a problem with the urea what? Cycle. So here, your best answer should be what? Disorder of ammonia neutralization in the ornithine what? Cycle. In the ornithine what? Cycle. So that becomes your what? Your likely what? Answer, or the cause of increase in what? In ammonia. You see why I said medicine is sweet. Everything is what? Is correlating. So if you understand it, you can apply it. So please try to understand these things and apply them accordingly. Okay. Now look at this question. Examination of a patient with frequent hemorrhages from the internals and the mucous membranes revealed, guys, look at it. We have what? Proline and lysine. I hope you remember what we talked about proline and lysine yesterday. Hydroxylation of what? Proline, and hydroxylation of what? Lysine. And in some question, you see what? Glycine. And they are all being part of what? The collagen fibers. And we said with vitamin is involved or plays a big role in collagen formation or collagen maturation. Yes, we said ascorbic acid or vitamin what? Vitamin C. We made mention of vitamin C. Vitamin C. Again, if you have not watched the video, please do yourself a great service and watch that video. So here you are thinking of what? Vitamin C. Vitamin C as your answer. We talk about this, so I don't want to waste our time on it. All right. Guys, look at this again. A 36-year-old female presents with a history of collagen disease. What comes to mind? Vitamin C. What comes to mind? Collagen. What comes to mind? Lysine, proline, or glycine. These things come to mind when you hear of collagen disease or collagenoses or vitamin C deficiency. These things come to mind. So here, what comes to mind over here? Of course, oxyproline. Proline is your guy. Proline is your guy. So here we are going in with what? With D. It's D. Okay. Look at this. Albinos cannot stand sun impact. They don't acquire sun tan but get sunburns. Disturbed metabolism is underlining this phenomenon. Guys, do you remember when we talk about phenylalanine? Phenylalanine. Yes, we talked about it yesterday. These people also do not like what? The sun. Now, apart from phenylalanine deficiency, what else comes to mind? We are also thinking about what? About congenital porphyria. Congenital porphyria. Congenital erythropoietic porphyria. These people do not like the sun at all. They do not like the sun at all. They do not like the sun at all. Now, in albinism, it means there's a problem with what? Or the absence of the pigment in the skin. There's a problem with the pigment in the skin. In the skin. So basically over here, we could be thinking about what? About phenylalanine. Because they don't have, tyrosine. They don't have melanin, because all of these things are part of the pigment of the skin. So tyrosine, melanin, all of these things are what? Are absent. And we know that phenylalanine is what? It's a precursor for thyroxine. Phenylalanine is a precursor for tyrosine. It's a precursor for tyrosine. Again, you can draw the map. So albinism means there is what? A deficiency of what? Of thyroxine. There is a deficiency of what? Of thyroxine, and as a result, melanin. And we are also saying that phenylalanine is the precursor for thyroxine production. So I hope you're getting the correlation between all of these things. Great. And these people do not like the sun at all. So here, your answer is what? Phenylalanine. Now, either to be thyroxine, maybe we would have gone for what? The thyroxine instead. Okay. A patient with continuous bronchopneumonia was admitted to the therapeutic department. Antibiotic therapy did not give much effect. Of course, we know people with pneumonia, we normally give what? Penicillins. And sometimes what? Macrolides. Now, what medication for improvement of the immune state should be added? Now, we don't really want to give more of antibiotic because the antibiotic is not working. But we want to improve the immune system. We want to improve the immune system. We want to improve the immune system. And the drug here that helps in the cell differentiation and enhancement of the T and the NK cells is what? Is Thymaline. So here you are thinking of what? Thymaline or Thymaline. All right. That is what is involved in what? Now, when we talk about immune system, we're talking about what? The cells, T cells, the T cell or the T lymphocyte or the NK cell, natural killer cells. These are the immune cells we are what considering. And for that reason, we give what? Thymolene. Thymolene. Okay. Now, a patient is suffering from hepatic cirrhosis. When we say hepatic cirrhosis, we are referring to what? A condition or a chronic condition of the what? Of the liver, whereby the normal cells will now become what? Scarce. Or you now start seeing what? Scarce or scar tissue being present. So the tissues are being replaced with what? With scars. Now, examination of which of the following substances excreted by the urine can characterize the state of the antitoxic function of the liver. So normally, in the urine, we normally see this hippuric acid in the urine. And this hippuric acid is actually what? A normal acid that should be found in the urine. It shows that the liver is working and it is what? Excreting what? Substances. It shows that the liver is working in what? And excreting what? Substances. So if you want to know the condition of the heart with respect to the kidney, you are thinking of what? Of hippuric acid. Hippuric acid. You are thinking of hippuric acid. Hippuric acid. And normally when you take in a lot of phenolic compounds, when we say phenolic compounds, we're talking about the fruit juice, the tea, and then the wine. If you take these substances, the level of hippuric acid will increase in the urine. That means that these compounds will be excreted from the body. They'll be excreted from the body, and hence hippuric acid will be what? Will be increased. And one of the most causes of hepatic cirrhosis are alcoholism. Alcohol. So we could think about increased amount of what? Hippuric acid in the urine. So here, your answer should be what? Should be A. Hippuric acid. Okay. We have vitamin A. Again, vitamin A has to do with what? With the eye, and then what? Wound healing. Wound healing. Always wound healing. Now, vitamin A, together with specific cytoreceptors, penetrates through the nuclear membranes, induces transcription processes that stimulate growth and differentiation of cells. All right. You see, so this is the why it enhances what? Wound healing, because it stimulates what? Growth and differentiation of cells. But the question now is what? How does it function, or what is the coenzyme, or what is the active form of the vitamin A? Basically, that's it. What is what? The active form of the vitamin what? A. And the active form of the vitamin A is the trans-retinoic acid. Trans-retinoic acid. That is the what? The active form. The active form of the vitamin what? The vitamin A. The active form of the vitamin what? A. So here you are thinking of what? Trans-retinoic acid. Trans-retinoic acid. So if you have this, that means that growth and differentiation will be what? Will be enhanced. Products of some proteins, hydrolysis and modification are the biologically active substances called what? Hormones. Hormones, of course. By the release of hormones, a lot of tissues begin to function and carry out their duties in the body. Now, lipotropin, corticotropin, melanotropin, and endorphins are synthesized in the what? In the pituitary or the hypophysis. By which of the following enzyme? Which of the following what? Protein. So what I'm trying to ask us is that which part or what substance in the hypophysis or the pituitary gland helps in the production of all these hormones? All these hormones. And your answer is what? POMC. 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 So you are thinking of what? Of POMC, because POMC releases all these melanocytes, corticotropins, and then lipotropins, and so on and so forth. so on and so forth. All these ACTH, all of them are all produced by what? By the punk in the pituitary gland or the hypophysis. Hypophysis. So here you are thinking of what? Punk. So your answer is A. A. Guys, look at this. In patients with biliary tract obstruction, the blood coagulation. Now, which vitamin is involved in coagulation? Coagulation. You are thinking of what? Vitamin K. That's what we give what? Heparin. You are thinking of what? Vitamin what? Vitamin K. Vitamin what? K. And they are saying that this blood coagulation is what? Inhibited. Now, the patient has frequent hemorrhages caused by which vitamin deficiency? Of course, you are thinking of what? Vitamin K. You are thinking of what? Vitamin K. And what do vitamin K really do? They help in what? In carboxylation of what? Glutamic acid. Now, before clotting factors can work, I don't know if you know about the cascade or the clotting cascade or the coagulation cascade. You'll be hearing things like clotting factors. These are actually the factors that help to cease bleeding. Okay. Now, some of them need to be what? Activated, or they need vitamin K before they can now be what? Be active. Before they can now be what? Be active. And usually, vitamin K is what is needed. And the process by which they are activated is called the what? The carboxylation of glutamic acid. The process is what? Carboxylation of glutamic acid. Carboxylation of glutamic what? Acid, whereby the vitamin K will be added to the what? To these clotting what? Factors, so they can be what? Active, and they can carry about with their function or their roles in the body. So here you are thinking of what? Vitamin K. Vitamin K. Vitamin K. All right. So here is what? A. Vitamin K. Vitamin K. And please, I think I mentioned something about heparin. Heparin is actually what? Anticoagulant. So I was also referring to warfarin. I was referring to warfarin. 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 That is the vitamin K supplement. Let me put it that way. It's warfarin. Heparin is anticoagulant. So here your answer is what? Is A. Good. Now, the study of the genealogy of a family with hypertrichosis. Hypertrichosis. Now, hypertrichosis simply means what? Excessive hair growth. Excessive hair growth. Excessive hair growth. And they are saying that this has been demonstrated that this symptom is manifested in all generations, only in men. It is found only in men. What does it mean? What it means is that so far as you are born a man, you must have this disease. In the family, you must have what? This disease. What does it mean? And we all know that every male must have what? A Y chromosome. Every male must have a Y chromosome. So what it means is that this disease could be what? Y-linked. This disease is Y-linked. Y-linked. If it's Y-linked, that means that every male will have it. Every male will have it. So here you are thinking of what? Y-linked chromosome. Y-linked chromosome. All right. So the answer is what? Is D. Look at it again. They say it's inherited by the son from the father. Son is male. Father is male, which means that it confirms the fact that there's what? A Y-linked chromosome. All right. We have a newborn child suffers from milk curdling in the stomach. This means that soluble milk proteins transform to insoluble proteins by means of calcium ions and a certain enzyme. Guys, what enzyme is it? Of course, renin. Renin. You are thinking of what? Of renin. Because that one is involved in what? In the digestion of what? Of proteins. So it is what? It's a proteolytic enzyme. It is a proteolytic enzyme. And in children or in all this kind of milk and all this stuff, we must produce or we must have this what? Renin being present. Renin being present. And I think the renin here they've spelled is even wrong. It's double N because this renin that they are written here actually refers to the RAS system. That is the renin angiotensin aldosterone system, which has to do with hypertension or ACE inhibitors or all these things. That's what it has to do with. But it is not renin. It is renin, double N, or chymosin. So if you don't see renin and you see chymosin, CHYMOSIN, chymosin or chimosin. I think it's chymosin. And it is very, very, very active in children, but it is absent in adults. It is absent in adults. And it is produced by the chief cells in the stomach. It is produced by the chief cells in the stomach. All right, so here we are talking of what? Renin, double N-I-N. Good. Now, the penetration of irritable cell membrane for potassium ions. What do we talk about potassium? We say potassium is needed because it helps in what? In polarization, right? It helps in what? Polarization. Then the question is that the penetration of the irritable cell membrane for potassium ion has been increased. So normal potassium helps in what? In depolarization. Normal potassium helps in what? Depolarization in the membranes. Now they are saying that there is an influx, mean there's an increased amount of what? Of potassium. What does it mean? It means there will be what? Hyperpolarization, because there's too much of what? Of the depolarization. It becomes what? Hyperpolarization. So here we are thinking of what? Hyperpolarization. So here your answer is D. All right. A sportsman was recommended to take a medication that contains carnitine. Doctors, do you remember carnitine? We said those who are fat normally use carnitine or use carnitine supplement to do what? To burn the fat. How? Because they remove fatty acid from the cytosol into the what? The mitochondria to be what? To be burned. We spoke about this like 4 or 5 times in yesterday's lectures. So once again, if you haven't watched the videos, please do justice to them. So here you are thinking of what? Fatty acid transport to the mitochondria. Fatty acid transport to the mitochondria. Where are they coming from? From the cytosol to the mitochondria. For what? For burning. All right. Okay. Now, to prevent post-operative bleeding, a 6-year-old child was administered what? Vicasol. So Vicasol is also what? Kind of what? Vitamin K. Look at it. Say, that is synthetic analog to vitamin K, you see? So again, I said vitamin K is needed in the what? In the coagulation what? Cascade. How do they affect their role? What they do is that they help in what? In carboxylation of glutamic acid. I talk about this in what? Carboxylation of glutamic what? Acid. This is where the vitamin K will now bind with the coagulation what factors to activate it, to activate it, to activate it. So here you are thinking of what? Carboxylation of glutamic acid. You see, everything is moving in it. Everything is. So if you understand it, no worries whatsoever. Now look at this. They said during examination of an 11-year-old infant, the pediatrician revealed osteoectasia, okay, of the lower extremities and a delayed mineralization of what? Of the cranial bones. Such vitamin is usually provoked by the deficiency of what? Such vitamin is as a result of what? Look at it. This has to do with bones. Bones. So you are thinking of what? Vitamin D. Vitamin D. You are thinking of vitamin D because vitamin D is involved in what? In mineralization. It's involved in bone mineralization. That means it helps to bring what? Calcium for the bones to be able to function well or to form well. And I said in our last lecture that calciferol is the same as vitamin what? D3. And vitamin D3 is also what? A form of what? Vitamin D. It's a form of vitamin D. Cholecalciferol is vitamin D. Vitamin D3 to be specific. Vitamin what? D3. D3. So here you are thinking of what? B. All right. Now, examination of a patient suffering from chronic hepatitis revealed significant decrease in the synthesis and excretion of bile acid. Guys, they are saying that bile acid are reduced. What is the function of bile acid? I've mentioned this over and over and over, but again, I will mention it. Bile acid helps in what? In emulsification of fat. It breaks down fat so that they become what? Digestible. So your answer is A. Your answer is A. Fat emulsification. Now, the energy input of a healthy man has been measured. In what position was the patient if his energy inputs were less than the main exchange? If his energy input was less. Definitely, when you are sleeping. When you are sleeping, you don't use any energy. Your energy level is what? Is quite what? Is low. Is quite what? Is low. So here you are thinking of what? Of sleep, because in sleep, your everything is shut down. Your conscious level is not thinking. Your muscles are not really contracting. Every part of your body will become what? Calm. Will become what? Calm. Will become what? Calm. So therefore, the power input will be lower. Will be lower than the basal level. Basal level is when you are actually active than the basal level. So here you are thinking of what? Of sleep. Of sleep. Sleep. All right. Glutamate decarboxylation results in formation of inhibitory neurotransmitter in the CNS. What did we talk about? We said when we talk about inhibitory neurotransmitter in the brain, that normally leads to convulsion is what? Is gamma. GABA. Is GABA. As simple as that. Is what? Is GABA. Is GABA. So decarboxylation of glutamic acid induces the production of what? Of GABA neurotransmitter. And this is an inhibitory neurotransmitter in the CNS. So when the patient is convulsing, that means the patient is what? Is hyper. The patient is what? Is hyper. So you need to stop it. So you need to give an inhibitory neurotransmitter. So you give what? The GABA. And the process by which it affects itself is what? Is the glutamate decarboxylation. Is the glutamate carboxylation. So here you are thinking of what? Of GABA. That's gamma aminobutyric acid. Gamma aminobutyric acid. All right. Now, in the course of histidine metabolism, in a biogenic amide is formed that was powerful vasodilating effect. What is it? What I'm trying to answer is that when you have histidine leads to the metabolism of what? Of histamine. And you know this histamine has what? A vasodilating what? Effect. Vasodilating what? Effect. So here we're talking about an allergic reaction. That is what? Histamine. So histidine leads to what? Histamine. So the answer is what? Is E. Okay. Now don't forget that histamine will cause vasodilation, but it will cause what? Bronchoconstriction. It will cause vasodilation, but also cause what? Bronchoconstriction. So please take note so you don't get the two messed up. Good. Now, utilization of arachidonic acid via cyclooxygenase pathway. Guys, do you remember cyclooxygenase? Of course. We are talking about what? The COX-1 and then the COX-2. And usually when you mention cyclooxygenase, what comes to mind? You are thinking of non-steroidal anti-inflammatory what? Drugs. And we'll talk about this severally, that you don't give a patient who is suffering from stomach disease, you don't give non-steroidal. Why? Because it will block this pathway. It will block this cyclooxygenase pathway. And why is this so important? Because cyclooxygenase pathway helps in the production of what? Prostaglandins. And we say prostaglandins are needed in the mucosa what? Lining. They are needed in the mucosa lining. So here we are thinking of prostaglandins. All right. It's the same question, but they're always, twisting the question so you can get it wrong. But please be alert. Now look at this question too. After a sprint, that means somebody is running, an untrained person develops muscle hypoxia. That means low amount of what? Oxygen. Now, this leads to accumulation of what in the muscles? Of course. We've talked about this severally. So again, you are thinking of what? Lactic acid or lactate. You are thinking of what? Lactate, because it is involved in what? Anaerobic respiration. Because there's no oxygen. So here, your answer is what? Lactate. Okay. Now look at this. Myocyte cytoplasm contains a big number of dissolved metabolite of glucose oxidation. Name one of them that runs directly into lactate. Name one that runs directly into lactate. Don't forget from, how do you call it? From the pyruvate, it either goes to lactate or it goes to what? Citric acid cycle. Okay. From pyruvate, it either moves to what? To lactate where there's no oxygen, or it moves to what? To citric acid cycle where there's oxygen to produce the energy. So here you are thinking of what? Of pyruvate. You are thinking of pyruvate. So here your answer is what? Is A. Your answer is A.